USMLE success. IMGs, international medical graduates, need to know the timelines of how you navigate through the USMLE success. Right? There are a lot of information I keep hearing nowadays about the challenges IMGs go through. But it's very important to look at the particular websites, USMLE websites, NRMP, AMA, and understand the timelines and also when to take your steps, especially now with step 1 becoming pass or fail. Most people are concentrating much on step 2 because that's the only one objective score to evaluate your credential, one of the credential in your application process. But again, since the step 1 has become pass or fail, the pass percentage has slightly declined, I guess, because people are not taking it seriously, I guess, because you just have to pass the exam. So you need to know what kind of preparation you need to go through for step 1, what materials you need to read, and what are the right timeline and how to do this. There are a lot of materials out there. USMLE, World, Kaplan, US First Aid Step for step 1, step 2, and there are other few called Sketchy, Patomas. These are high yield stuff to read for these exams, but you need to have a structured approach. Some people like to have study partners, which is good. If you have like-minded thinking people, you can group up with, and that has helped many people. Some are reading and learners, some are visual learners. So you need to figure out what you're good at and get some advice. Get hold of a mentor. That will help you. They'll guide you through the process. I'm not saying that they'll make it 100% easier for you, but at least they can make it somewhat navigatable. Use that word. All right. So that is very important. Then one of the most important things is US clinical experiences. So how many rotations you need based on the specialization you're applying for, right? And your personal statement. This is one big one where IMGs stumble upon because we are not used to these things back home. Then how to get good LORs, which is letter of recommendations. You need to set a stage to obtain these letter of recommendations when you do your clinical rotations. All right. All of this should match your undergrad and med school performance. Your MSPE, your medical transcript, your dean's letter, so-called. So all of this should match, and it's a culmination of all these things which the programs look into. Of course, the step 2 score is important. I'm not saying no, but all of this is important for them to consider giving you an interview. Then again, all these credentials will give you interview, but again, what gives you the program is how you perform on the day of interview. So that's very, very important. There are mock interviews. You can try to do them online or with your colleagues or peers. That will help you. So these are some of the things which are very important. Sending a letter of intent, then keeping in touch with the programs. If most of them are now virtual interviews. All right. So in a nutshell, the way you navigate through the USMLE success and overcoming challenges for international medical graduates is to first understand the structure of USMLE process, the ERAS application, and NRMP matching. There are a lot of resources. So go through them first before you start your journey. That is the most important thing. What else?
Okay, so Dr. Satya, can you highlight the importance of the personal statement and its significance for the international medical graduate?
So here what I'll tell you, that's a very important thing. Personal statement, I mean, it doesn't have to be completely perfect. Everybody's story is different, all right? What you have gone through your life. And more often than not, people get it wrong that the personal statement has to be tied everything towards the field you're looking into, whether it's internal medicine or family medicine. They're absolutely wrong. You can dive towards that eventually, but it is about you. Who are you? What are you? What brought you here? And why are you here? And where you want to go from here? What are the values you carry with you? What are the hardships you've gone through? And how you have come over those hardships? These are some of the things which are very important in your personal statement, right? And I'm sure IMGs have gone through a lot of hardships, even through their careers back home. So mention those clearly. Make it a point that those values, what you have acquired from, whether it is your family, social circle, how it has helped you to shape you as a person. That is very important. That's what the program wants to know. It's not about putting a sad story in your personal statement. Oh, I went to a hospital with my grandmother and there was a sick patient. I got empathetic and now I want to be a doctor. That's not what they're looking for. That's not what the programs are looking for. Everybody probably has a story to be a physician, but what are you? That is important. I mean, physician, of course, you want to be a physician. I mean, but what is that baggage you carry? What's your philosophy? And how serious are you in this profession? What is it like helping people? So this is what you need to put it in your personal statement. Don't just mention, a couple ridiculous experiences which don't make any sense, and then say that I want to be a doctor because of this. That really doesn't help. When they start the first paragraph, make them read the whole personal statement. They need to know you before they call you to an interview. All right. So that's one opportunity for you to tell about yourself as a person. The very nomenclature is pretty self-explanatory. Personal statement. It has to be a statement about you. It is personal. All right. So yeah, that's what I would say. And talk to somebody. Talk to an advisor. Get edited. And put your strengths of your in your personal statement. And what is that one or two things the program needs to know about you? Why they should choose you out of, call it 2,000 applications? Those things are very important. Rather than just saying, oh, I'm a hardworking doctor. Of course, you have to work hard. There's no shortcut to success in this field. All right. I'm punctual. Of course, you have to be punctual. I'm a caring person. I'm empathetic. Of course, you have to be. So those are not the ones we are looking for. You're looking for something which you can tell us, which your application is not telling us. Right? Yeah.
Okay, docs, some people these days use the artificial intelligence like Chat GPT to making these kind of the personal statement. So
what's the question?
So I'm asking about, so they deduct these kind of thing using the artificial intelligence making personal statement. So it's, I think, what is your opinion on that, using artificial intelligence to making personal statement?
Okay, so here what I'll tell you, I'm not sure if this name should be changed. Artificial intelligence. There's nothing artificial about the intelligence. It's all humans feeding data into this, and the machine has the capability of pattern recognition. All right. So maybe it can't think more than what we can think, but I guess some AIs can be empathetic also. So here what I'll tell you about using AI in personal statement. We use AI, we've been using this AI in a different format all throughout our medical careers, right? In a different format. It's only now this AI has become a big issue, all right? I can give you several examples, algorithm-based examples where we use routinely, all right? Somebody comes in with 2 or 3 symptoms and we say this is the diagnosis. How do we know that that is the diagnosis? Because we have learned that. We have been trained that way. Somebody comes with a chest pain, shortness of breath, and so on. This is the diagnosis. Somebody comes with fever, cough, this is the diagnosis. So artificial intelligence, use it. I mean, I don't think there is any downside to it, but don't make it a point that you leave it to the artificial intelligence to pretty much do everything for you. Then you're really making the definition artificial intelligence. All right, put your intelligence first. Write, sit, and free flow writing. Write a personal statement about yourself. All right. If you have issues with English, if you have issues with grammar, all right, if you have issues with how to frame sentences, yeah, take help of artificial intelligence. There's nothing wrong with that. But don't make artificial intelligence write your whole story. It doesn't know your story. You know your story. So you put your story on the paper, and then have artificial intelligence help you streamline or scale down and see how, again, you have to edit what artificial intelligence has edited your statement. That's where you play the bigger role. All right, it has to enhance your skills, not replace your skills. There's no role for that.
Okay, Dr. Sathya, can you please shortly discuss about the main filters?
What do you mean?
Like the step 2 CK scores, personal statement. So what is the importance of the step 2 CK score? Now the step 1 is a pass phase.
Well, as of now, since step 1 is pass or fail, the emphasis is completely on step 2. All right. You better get a pretty competitive score in your step 2. I mean, that's but natural. There's nothing more I can add on that. You really have to sit through and read thoroughly and get an excellent competitive step 2 score. That is very, very important to start with. If you don't get through the step 2, whether you fail it or you get a suboptimal score, then you have to look at other aspects of your application, how you have to improve. And not that if you get a good step 2, you should not improve other aspects of your application. But again, how do you uptight your clinical rotations? Trying to get into a university clinical rotations, try to get into clinical rotations where there are residency programs, get involved in those clinical rotations, make yourself heard or visible, present cases, attend conferences during those, and make sure you talk to somebody about your letter of recommendations. And if possible, if you have already written a rough personal statement, hand it over to the person who's writing the LOR to say, hey, this is so I need a letter of recommendation from you, and this is what I have done. And do that very early, not now. All right. Now is the time everybody is busy, including the people who write letters. They have clinical work to do. 200 people requesting LORs, that's not easy on them either. All right. So that's one thing. The second thing is research. This is a very, very touchy topic when it comes to research. No program is looking for a PhD student. All right. Don't go and do all the kind of stuff which is, I mean, irrelevant for your field. All right. You need to understand the concepts of research. All right. So that the program understands that when you, as a resident, work here, you are able to interpret literature, what is evidence-based medicine, and how it will help you practice clinical medicine. That's the kind of research, like case reports, poster presentations. If you have got a chance to work on some RCT or something, you tell them what work you have done in that. People say you should report only the published ones. Not necessarily. All right. Everybody knows how hard it is to get papers published nowadays. It's not easy. All right. But even if it is not published, you can put it on your CV and say, this is the work I have done. All right. So just don't say, what is the impact of elevated troponin on PE outcomes? But what have you done in that? What is your work? So that's what is very important. Then Of course, I talked about personal statement. So these three are very important. Your step two score, your clinical rotations, research, and your personal statement. So if you can put together these things, then the rest, which is application process, sitting and figuring out what programs you need to apply, which are IMG friendly programs, then what values you carry and which program fits your criteria. Programs already know what kind of candidates they want. You need to know what kind of program you want, right? What city you're going to go and live in. Is it conducible for you to be there? What is the diversity of the program? What are the electives? All these are very important. And that will all depend upon your profile too. You can't be having a score of 225 in step two and looking for and 2 US clinical experiences and 1 or 2 publications looking for Mayo Clinic or John Hopkins and Harvard to match, right? That doesn't work like that. So based on your profile, you should be looking for programs, whether it is university-based programs, unit-affiliated community programs, or community programs. All right, that's what I'll say. These things are very important.
Dr. Satya, can you see the chat? There is a question from the participant. Can you please look at that?
Sure. Let me see, what is it? There's a question from USMLE aspirant. He or she says, we are from another country, and even though we speak English, it may not be as good as Americans. How do you think this will affect my journey? Okay, all right. So that's a good question. So all the programs in this country understand what are the challenges of IMGs, right? So one of the criteria for you to even get certified or ECFMG certified is you need to do that OET exam, right? The English exam, English proficiency or communication skills and so on. The general consensus is if you do that test well, it is understood that you're able to manage decent English, whether it's communication, writing, reading, whatever it is. Now, I guess most people pass those exams, but when it comes to real-time speaking, you don't have to be speaking fast like me. I have the habit of speaking fast, louder. You don't have to. You speak at your own pace. It doesn't come easily for us from back home. We have to practice this. If you don't practice this, that means if you don't interact with people around you, and if you always interact with people around you in your own home language, then it becomes harder all of a sudden talking in another language, which is English, call it. Europeans also have that problem. Just don't think it is only from a southeastern part of the country. Language, using proper words, pronunciation, all this is a problem for international medical graduates, not just only from India, Pakistan, Bangladesh, Sri Lanka, or Middle Eastern areas. So you have to train yourself how to talk. The biggest problem with IMGs I have seen over the last 10 years is they hate to communicate with people. You have to put your good foot forward and start talking to people. The only way you're going to learn to speak better and do well is make mistakes, all right? Have somebody correct you, right? So those things are important. If you don't communicate with people, and if you think doing an exam will make you a better English reader or speaker, absolutely wrong. Talk to the nurses on the floor. Talk to the aides on the floor. Get used to their names. Pronounce their names properly. So these are very important. Even back home, try your best to talk in English. That will help you because you have made up your mind to go to another country like United States, which is an English-speaking country. Come here, though you have to start from day one. So that's what I would say. Communicate, communicate, communicate. That will improve your English, not just doing an exam called OET. Anybody else have any questions, or are we moving on to another topic?
Okay. So anybody from the participants? Okay, Dr. Satya, can you highlight how can someone improve their CV?
Yeah. So CV, a lot of it is, I'm not going to get into the personal information and all that. Now, the most important thing is your experiences. This is where most people stumble, especially the IMGs. There's a section where you have to write about impactful experiences and what other experiences which has been meaningful to you, all right? A lot of people think this is all about, again, medicine experiences. Yeah, I mean, if you have some clinical experiences, medical experiences, which has impacted you, which has impacted on your life or your thought process or how to go about your profession, yeah, do mention that. I mean, I'm not saying no, but what they're trying to tell you is, are there any other experiences in your life, in your journey, whether it is through med school, undergrad, whatever it is, which really has impacted your way, how you look at yourself and what have you learned from these experiences. That's what is called as an impactful experience. Whether it's a voluntary work you have done in a blood donation, and what have you learned from there? Have you worked for some NGO, all right, non-governmental organization? Have you worked in certain camps? All right. So these are certain things they're looking for. Are these experiences which has taught you some lesson in your life? Right. It doesn't have to be always medicine. Trust me. And be ready and be prepared to explain these things during interview. Right. Not just mentioning. And whenever you mention something, please explain that so that they understand what you're trying to say. Don't just say, oh, I worked for a blood bank and I did some camps for 3 months. Yeah, so what? Why is that impactful? Can you please explain? So you have to explain that. Everything what you write, you have to at least give 2 or 3 sentences of what this was, what you did there, and how it impacted you. That is very important. So I give a lot of emphasis on these things, other than step scores and personal statement and so on. The experiences you have is very, very important.
Okay. Dr. Satya, can you look at in the chat box?
Yeah,
There is
yeah.
another question from the participant.
So it says Habiba Shahid. Okay. What are the chances of match for a candidate who has failed step 1? Yeah, Habiba. So that's not good, not a good situation. Any failure is not good, of course. But again, what there are programs which overlook these failures too. Not every program is saying, "Oh, no failure, we are not going to take them." No, there are programs which say that, okay, you failed, but what have you done after that? Somebody has failed a step 1 exam. Of course, now it is pass or fail. You really can't gauge the hard work you have put in, because next time you're going to pass. But say, for example, if there was a low score and you failed, and then second time you worked hard, you strategized yourself, and then you had a really good spike of score, right? 250, 260, whatever it is. So that's what you have learned. You reorganized yourself and so on. So you have to show that, not just failing and again you're barely passing the next time. And that doesn't really help the application process. Now, step 1, it's a tricky situation now. So you pass the step 1, which is going to be, again, you're going to do that, but see what you can do for your step 2 exam. Can you do well in your step 2 exam? How do you hide your failure? There are certain strategies you can have. Try to hide your previous failures. You can't undo what is already done, but how you can improve on other things. Get a good step 2 score. Read well, prepare well, take an extra month or 2 to prepare, other than what routinely needed. All right. Then do good clinical rotations. All right, write a good personal statement and explain to them in the personal statement how this step 1 failure happened and what you did and how you strategized to your step 2 and what you learned, what lessons you have learned and how you've done that. That's personal to you. That's a challenge you have overcome in your life. Put that in your personal statement. all right? Then research publications, try and get involved in those things. So when you have so-called red flag in your application, try and see what you can do the other aspects of your application. Then try and get your step 3 done, and try and get a good score in your step 3, so that the program knows, hey, you know what, this candidate really understands what failure means, and he or she has come out of a failure and shown us that she can do it. So these are the strategies you ought to employ, not just sit and dwell on the failure. Try and see how we can improve the other aspects of, and there are a lot of programs who do overlook these things. I have helped IMGs myself, mentored them through this process, and helped them get into residency programs, helping them, because I do mentor international medical graduates. So this is where linking up with an advisor or a mentor will be very helpful for you guys.
Dr. Sathya, another question on the chat.
Let me see that. Other than research publications, so this is from Freddie Pulikal. Other than research and high USMLE scores, what other factors can we make our application stand out for a particular residency program, surgery or IM? Yeah, I mean, when it comes to USMLE score, it's only step 2. I mean, you really don't need step 3 to even apply for programs. All you need is ECFMG certification, which is step 1, step 2, and OET exam. All right. So when you're asking me other than research publications, yeah, I mean, your clinical rotations I just talked about, or make sure whether it is surgery or internal medicine, you do the appropriate clinical rotations, and make sure you get excellent letter of recommendations, not the run-of-the-mill letter of recommendation saying that, oh, he's a punctual guy, he knows how to do an HNP, he knows how to talk to people. No, there has to be something exceptional. The writer has to write you about you, all right? Whether it is whether you're going to surgery or IM, and make sure your clinical rotations are not just like, even though they are called observerships, but you have a lot of chance to get involved in the discussions. You might not see patients, you might not do much of clinical work, but you can do things which you can impress them non-clinically also. Talking to the staff in the hospital, nurses, getting involved, which will also improve your communication skills and other things though. People have to know what you are to give you a letter of recommendations. All right, then step 3, yeah, go ahead and do it. If you think that will help you your application. In the past, my time, step 3 was for H1B only, but now if you have any deficiency in your applications, you can go and do the step 3 and get a good score, not just doing step 3. No, reassure the program that you're ready to practice medicine in US. So it's not just one particular aspect of your application which is going to give you an interview. You have to have more than 2 or 3 things which stand out. Remember, you're competing among your own pool first, which is IMGs. Then when you come out of that, you're competing with the AMGs. So you know what is out there. My sincere advice is get an advisor or a mentor, sit with them, talk to them, go through and put a strategy to yourself. No point crying at this stage where you're ready to apply for programs and now you stumble upon and say, hey, you know what, I had only 2 experiences, my research is not good, my personal statement, I don't know what to write. This is not the time. You talk to an advisor. It is very helpful, trust me. People disregard this. It is very, very helpful having an advisor or a mentor going through this process, because this is not an easy process, my friends. This is not an easy process. Okay, let's look at other questions. Can you start residency with just step 1 and step 2? That is for AMGs, American medical graduates. They don't need to be ECFMG certified. For international medical graduates, you have to be ECFMG certified That means step 1, step 2, and OET exam. So what is the significance of step 3? As I said, the significance of step 3 is looked at as in a different way. As I said, if you have a failure in your steps and then did well, and I would say, okay, go do step 3, all right, and get a good score. It's not about just doing these exams. Whichever of these exams is tied to a score, try and get a good score, not just passing to the, oh, I'm done with my step 3. Everybody pretty much most people get done with step 3, but what is your edge in the application? Okay, I got 240 plus. That's good. You're ready for clinical practice in US. All right. So that is the importance of step 3. In terms of visa, I'm not sure how important that is nowadays, step 3, because most programs do give J1s. So it doesn't help. Step 3 is only for H1s. But again, a lot of programs are shying away from H1 visas because of the application process, the fee, all that stuff. So it doesn't help that way. But if you have any deficiencies in your application, or you want to show the program that you're ready to practice medicine, then do the step 3. Yeah, it is important. I'm not saying it has no value. Thank you. Okay, all right. Let's see what is the next one. Thank you, sir, for taking time for us today. We truly appreciate it. My question for you is, what additional details other than punctuality, etc., can have a positive impact on our LOR? Dua Gul, let me tell you something. Punctuality, tell me, is that something which really sparks a light in anybody's brain that a doctor has to be punctual? You have to be punctual. All right. A doctor has to have good history taking, of course. Physical exam, of course. Differential diagnosis, of course. But what the LOR should look like is, hey, this is a person who came to do observership, all right, and he had excellent communication skills, all right. He always came forward to discuss about patients. He was very empathetic about patient care in our team. He looks like he was a team worker, all right. He appreciates diversity, all right. So these are qualities which a physician should have, but most don't, all right. So those are the ones you have to show, all right, and ask questions, show that you're eager to learn, not just medicine, the healthcare system in this country. So those are the things which should be in your letter of recommendation. That is very important. It's not just about punctuality and he always came at 6:30 in the morning. So what? I mean, that's the least of the thing. Then, hold on a second. Then the next question. What additional detail? Okay, I meant other than generic terms such as punctuality, etc. What a PD look? I mentioned already. So, USMLE aspirant, what are the chances of IMGs matching into surgical specialties? A few people suggested that I shouldn't waste my time trying to match into surgical specialties or spend money doing rotations in those specialties. What is your view on that? My friend, there is no single specialty where IMGs are not. Every specialty is as IMGs. All right. Now, then what you need to do to get to where you want to is where you need to get an advisor or a mentor. All right. I know there is the competitive pool for IMGs is FM and internal medicine. All right. I understand that. But surgery, not easy. Radiology, not easy. Or OBGYN, not easy. But is it impossible? Absolutely not. I've helped people get into these programs. So don't even think of anything impossible. But are you ready to put in that hard work? Are you mentally and physically prepared to do that? All right. because there is no shortcut for all these things. So that's where you have to set the stage and be mentally prepared. All right. I know there's a lot of things about going to USMLE and doing residency, fancy stuff, US lifestyle, all that. Yeah, it's good. I'm not saying no. All of us enjoy that. But you need to be ready and understand the process to get where you want to get to. If you don't, that's where you start burning out. You start getting depressed. You won't know what help you need to seek. So you have to go through an advisor or a mentor for any IMG. I will tell you, it will be your lifetime experience. Trust me, you learn things which you would have never thought about. That's what I would say. All right. Okay, we did that. Ahmad, again, as an IMG, I heard it's almost impossible to get residency in plastic surgery again or neurosurgery programs. I don't like the word impossible. I already explained that. But if you have the right attitude, again, my friends, if you are willing to put the hard work you want to put in, I don't think there is any specialty that you can't aim for or dream for. All right. But as fancy as it might sound, what I'm saying here, most people are not ready to put in there. They think this is what they do and they should get in. That's not how it works. You have to be ready to put in the hard work. Then you have Prasansa Pandey. Is it okay to use last year's LOR along with the new ones while applying? Absolutely. Absolutely. And if we are dual applying, is it okay to use US LOR from cardiologists in US to apply for pediatrics? Well, here what I'll tell you. That's a very good question, Prasansa. I don't know why should an LOR be expired as long as you have done that work. I mean, it can't be remote like 3-4 years of LOR. Then it doesn't make much clinical sense in that. But if it is last year LOR, yeah, use it. Now, when it comes to LOR written by another specialist for another residency program, yeah. So here is my take on that. I've read LORs given by family medicine people saying that this candidate is an excellent candidate for internal medicine residency. I have internal medicine residents written LORs saying that this candidate, as far as I know, will be a fantastic cardiology or fantastic family medicine or OBGYN. So there's nothing wrong with that. All right, somebody is substantiating your work, right? So why does IM have to give only IM recommendation? That's pretty much standard. That's what you go for, right? You want to be an IM physician, you go into IM rotation. But for some reason, the IM physician finds that, hey, you know what? I'm not sure if you're good in IM, but I think you're a very good family medicine person. Come on, I would love that kind of LOR. Definitely. How does publication in a Pakistani journal carry any weight? As long as it's credible, my friend. As long as open journals are not accepted well, but as long as the publication, journal publication has credible PMID number, all those things, absolutely. Why not? How important are research PA fellowship positions for IMGs aspirant to match for ENT or other surgery related residence? It is important. It is important. You have to, you really have to look into these things. In fact, some research positions for ENT, there is another alternate pathway. And if you sit with an advisor or a mentor, definitely somebody can help you with all those things. All right. It is definitely important. All right. Freddie Pulakil, at present day, how can an IMG get pre-matched with step 1 pass or fail? What is step one got to do with pre-match? I mean, you know that, right? Nowadays programs either go full pre-match or match. You can't do half and a half. That's against the IRA's rules. All right, this has been for a few years now. All right, if you apply to programs where they give only pre-match, yeah. So what's the? It's not the question of how can an IMG get pre-match. It's the question of what substance do you have on your application. All right. So it's all about the substance and what you are to get pre-matched. Next, how can we get paid research positions in US? It's hard, my friend. Habiba Shahid, it's not easy. You really have to contact a lot of research centers. Cold emails might not work. If you know somebody, network with them. Paid positions is not easy. Now, first of all, they don't have any funding, right? Most research funding comes from either GME or NIH. So you really have to, it's not easy. That much, again, impossible? No, but it's not easy. It's not easy. Trust me. But why are you looking into research positions? That's what I would want to know based on your interest, I guess. But yeah, these are some of the sacrifices you have to make, as an IMG. I hate to say that, but that's exactly what I mentioned before. Are you ready to put into that kind of hard work to reach where you want to? The road is not easy. You have to pave your way. Trust me, it's not easy, my friends. To improve CV and make some money for USMLE, but yeah, exactly. I'm not saying no, but it's not so easy to get paid positions. It's not. The funding is not there. There are so many PhD positions which have been declined this year. Legitimate PhD candidates who have applied just because of no funding for international graduates. So let alone you're looking for research positions, postdoc or whatever. It's not easy. Yeah. Any more questions?
Dr. Satya, I have a question that
Sure.
because I am working in the medical college in my country, so
Yeah.
that is not a clinical. So I am teaching the medical student like the first year MBBS and second year MBBS. So that is a demonstrator job or lecturer job. So it's a worth it for the match. Can you
What do you mean worth
highlight?
it? What do you mean by worth it for the match?
I think what is the should I mention these kind of things, the teaching?
Absolutely. Absolutely. In fact, that is a meaningful experience you should. You're imparting knowledge to medical students and how you have shaped their lives, how you have changed their lives. You must and should mention that in your out of the 10 experiences and meaningful experience. That is.
So I am also doing the webinar like with you and many step two.
Absolutely.
So these are worth
Absolutely.
it.
You have to mention that. How many people are you educating by doing this? Do anybody have time to do these things? Everybody is looking for themselves. And you're coming out of your comfort zone and trying to help other people. This is how you are impacting somebody's careers by doing this. You have to mention these things. These are the things they're looking for. Anybody else has anything to say? Or any questions?
Doc, there is a question on chat. Can you read it on the chat box?
No, I think I addressed that last thing, right? To improve CV and make what other jobs can IMG do to improve CV while being in US? Well, I mean, when it comes to jobs, it's all about your how clinically you are oriented. All right, you have to do clinical work, if not research. What else can you do to improve your application by in field of medicine or surgery? You have to show that your clinical or interest or research. All right, you can't be working in a Walmart or something else, or as an accountant or something. Do something in public health, that will help you. All right, but these are pretty much the ones you should be looking into. All right, yeah. Can a long gap in year of graduation be a red flag? First of all, this word about red flag, when you say red flag, it scares people. All right. So I usually don't like to use that word, but year of graduation, the general consensus among programs is long year of graduation is not so good in your application. I'll tell you where this philosophy came from. This philosophy came from programs where start thinking that the longer you are away from your clinical work or pursuing a profession or upgrading your profession, you're not inept with current trends in medicine practice, right? To some extent, it is true, people who pass their MBBS or whatever and not pursue post-graduation, got into clinical work. Not sure how many of them are really upgrading themselves professionally, right? Other than working, right? Or reading journals or doing any research work. That's not the case back home, all right? So that's what the programs are looking for. Have you done any clinical work since you did? Or just now somebody put in a question, a master's in public health, all right? MBA in health management. Yeah, those things are good. Definitely, those things are good. It doesn't have to be all clinical work. But what you have done in the healthcare industry is very important. All right. So if you can show that, that's where you are undoing your year of graduation so-called red flag. All right. So prove yourself that you're doing something after your year of graduation. Yeah, does masters in public health from Pakistan University carry weight? See, all this about carrying weight or not carrying weight is the credibility of where you're doing it from. I mean, there are a lot of people, lot of applications I see, they're doing 20 things at one time because all of them are online. I'm not sure how credible they are. All right. If you're doing from a university where it is credible, well recognized, I'm sure every degree, I mean, our MBBS degree is recognized. So why shouldn't something else? All right, they are allowing us to come and practice medicine here just by doing some exams and doing some rotations. What makes anybody think that that should not be important? It should be important. But again, what you have learned, where you learned from, the credibility is most important. What else? Let's see. Khizar Ali. Sir, what is the pathway to do electives or observation in America and how much does it cost? Well, I hear some lot of information about this observerships. There are paid, unpaid, all these things. So you have to contact people, send emails, look up AMA website and find out where are all the hospitals which are providing observers. Email them in advance. The process usually takes about 3 to 4 months, if not 6 months. All right, because they get tons and tons of emails from everybody asking for observerships. All right, but again, coming to the same point, if you find an advisor or somebody who can help you mentor through this process, all these things will be just made easy for you, right? Because as a mentor, I help IMGs with all these aspects, getting how to help them get research publications, how to help them get clinical rotations, how to get a good LOR, what you should be doing to get a good LOR, how to help you write a good personal statement. This is all what I do as a mentor. So not that I'm going to be like an AI writing it for you, but I'll help you. I'll be a good asset, or any mentor for that matter. It'll be a good asset for you to go through this process. Somebody can advise you. Otherwise, you're going to talk to 10 people and 10 people are going to give you 10 different ideas and you don't know which one to hang on to. Now, again, Khizar Ali says, and is this a meaningful experience to add in the CV as compared to do electives in my home country? What do you mean? What is a meaningful elective? I mean, what is the meaningful experience you're talking about? I didn't understand that. Sorry, sir, doing electives in America. Yeah, I mean, it's not just doing, it has to be meaningful to you. What have you learned from that elective? All right, whether you do it in US or whether you do it in your home country, how has it helped you? What you learned from that, and what have you contributed to that elective? So that's the key thing there. Where can I find a good mentor? All right, let me. Is it okay to put my information here, Faizan?
Dr. Satya, okay, I have no issue. I already shared your YouTube links where you discuss about the way talk facts, and if you are sharing your information, I have no issue. You can share your information.
Okay. All right. What else? Anything else? Well, if we don't have any more questions, I think we almost hit a lot of time here, close to 1 hour. So this was a good session. Please go to my website and read about things. There's a lot of information there. I have some blogs. If you have any questions, send an email to me. My information is all on the website. I'm more than happy to help you guys. I mean, when I went through this process, I barely had any mentors, and I know what it means going through this whole process. It's not easy. It's a total different ball game compared to what we do back home in our countries. But there are a lot of help available here. All right, there's a lot of help available. Okay, somebody's asking me a question. Sir, I started step 1 preparation recently, but not studying effectively, and I'm not satisfied with my preparation. How should I study? That's where you need your mentor's help, my friend, Abdullah Tariq. Maybe your strategy is not right. Your structure of studying is not right. The material is not right. Maybe you need a partner. So whatever it is, you need to sit and discuss with the mentor and figure out what the problem is and get back on track. All right. So if you have anything, my information is with the host here. Talk to him and he'll provide that. All right. All right. I think thank you guys. Thanks for the questions. Good questions. And I'll be more than happy to do more sessions if you guys want. Any specific session you want me to help you with? Yeah, sure. More than happy. All right. And I also have my own podcast, my YouTube channel. Faizan will send the link. Go and look at my videos and my LinkedIn profile. Follow me on my LinkedIn. You'll get a lot of information. So yeah, more than happy to help you guys. All right. Thank you, Faizan.
Thank you so much, Dr. Satya, for such a great informative session.
Okay.
I hope we will do more session on the future for specific, like CV, personal statement.
Yep.
And
let's stick to one particular thing and
yes,
do 15-20 minutes or like that. All right.
Yes. Thank you so much. Thank you so much.
Just give them my access to my website and the YouTube channel so that they can have more information. Okay.
Okay. Sure.
Take care.
Thank you. Bye-bye.